Mental illness is the single largest category of disease affecting Canadians. When mental illness occurs, there can be a significant, sometimes tragic effect on individuals and families. Dr. Murray Enns is the Medical Director of the Winnipeg Regional Health Authority Mental Health Program and the head of the Department of Psychiatry at the College of Medicine. He is tasked with overseeing mental health service delivery in Manitoba and in planning for the future.
I think over a couple of decades, the amount of stigma attached to mental health issues has come down some. I certainly would not say that it's disappeared by any stretch of the imagination, but I think it has improved to some extent.
One objective is for psychiatrists and counselors to establish a portion of their practice in the offices of primary care physicians.
By doing that, it reduces stigma, it increases availability, and it also increases the capacity of the primary care practice to deliver mental health care. We're tremendously reliant on primary care physicians in providing frontline mental health services.
Dr. Enns stresses that creating effective interdisciplinary teams is one way to meet the significant mental health needs in the community.
There's all kinds of people that can carry important pieces of the mental health load. Psychologists make a very important contribution, nurses, psychiatric nurses, social workers, very important role for occupational therapy. There's definitely a role for a variety of disciplines, and it's definitely not a psychiatry-only show.
In 2013, the Crisis Response Center opened at the Health Sciences Center. It is intended to be an alternative for voluntary patients who are seeking urgent mental health services.
We've seen more people willing to seek help. We've seen more families engaging to become part of the care plan for their family members with mental health issues. That's been very important.
When someone feels the need for mental health services, they should first talk things over with their family doctor.
But of course, some issues really arise very urgently or emergently and then need care as soon as possible. And for that kind of situation, people do access emergency departments, and that's a very reasonable and appropriate kind of thing to do. Several different emergency departments have 24/7 access to psychiatric services.
In addition to the Crisis Response Center, there is a Crisis Stabilization Unit at 755 Portage Avenue, which is an alternative to hospitalization for people who need a suitable place where they can receive support and help in working their way through a crisis.
We also have several access centers in the Winnipeg region that are significant sources of mental health service, including the provision of assertive community treatment. Assertive community treatment is a treatment model where we bring wraparound services to people with high mental health service needs, to patients where they live in the community.
While mental health services are quite accessible in Winnipeg, a priority is growing capacity in other centers throughout the province.
Brandon has a large constellation of services. Selkirk has a large constellation of services. Eden Mental Health Center in Winkler has a significant constellation of services. And there's a scattering of services in more northern communities like Thompson and the Pas as well. But there is still some disparity between urban and rural regions in terms of the overall amount of service available. I think we're making movements in the right directions. I still think there's an awful lot to do. I think that the overall number of services can certainly continue to grow in the upcoming years. I definitely see an important trend towards more and more teamwork taking place involving psychiatrists.
Making the decision to become a psychiatrist was the right choice for Dr. Murray Enns.
I guess what really appealed to me the most in my medical training that led me to choose psychiatry as a career is the connectedness with other people that you can get in psychiatry that is present in other areas of medicine as well, but is definitely stronger and more dominant in psychiatry. And this is what psychiatry really left out in its appeal for me about, was the ability to get to know somebody better, get to know a lot about what made them tick, get to know how they got to be where they are, and then really coming up with a comprehensive plan to try and help them on a bunch of fronts in their life. And when you succeed in helping somebody like that, it's a tremendously satisfying thing.